There is a 18-year-old male who is coming to you with pain around the knee, which is worse at night pain. Not relieved by taking aspirin is a highlight. X-ray shows a lesion in the metaphysis of the distal femur with a sunburst appearance and Codman's triangle. With a sunburst appearance and Codman's triangle, what is the most likely diagnosis? So guys, please understand this thing is very interesting and important for all of us. I'll tell you why. First of all, osteosarcoma, yes, men are more commonly involved as compared to women. Yes, it can happen in 20s to 40s, 18-year also possible. This will give you pain in the night, which will be worse, of course. But you know what? Usually proximal femur is involved. You know what? Diaphysis is usually involved. You know what? Aspirin relief is classical, and they have clearly mentioned no relief on intake of aspirin. So far so good. So I don't think it is osteoarthritis because aspirin is not helpful, and aspirin normally helps in osteoarthritis because aspirin is salicylate, which inhibits prostaglandin synthesis. Osteoarthritis has a lot of prostaglandin inside, so that's why. Now, giant cell tumor, first of all, women more than men. Second of all, it's a problem of 20 to 40, of course. So, okay, fine. In the question, they can give you men, they can give you 18 years, that's okay. Distal femur is the most common site, absolutely. There is no confusion about it. But now comes the classical point that it is usually epiphysio-metaphyseal, but that's okay. Question says metaphyseal location, that's okay. Now comes the most classical point, soap bubble appearance. In X-ray, they have nowhere mentioned a geographical destruction or a soap bubble appearance. Now, Ewing sarcoma, osteosarcoma, let me tell you, Ewing sarcoma, boy more than girl, let me tell you, 5 to 15-year age group. It is very particular. Ewing sarcoma is the most common primary malignant bone tumor of first decade of life, so it is very particular about Ewing sarcoma. Anything anything like that in the question? No. Femur, yes. Shaft, yes. Diaphysis, yes. It's a diaphyseal lesion. And now comes the most important point, which is an onion skin or an onion peel appearance, and I'm sure you can see the question does not mention anything like that. Osteosarcoma, the classical age group is 20s, male more than female. Distal femur, metaphysis, and yes, X-ray classically shows sun ray or sunburst appearance, and along with that you have something called as Codman's triangle. So although I must say that although it was a very simple guess, answer was a very simple guess, but still, you know, you should develop this habit in every single MCQ whenever you are solving, not to just get the right option, try to work on the remaining options, because you may not know, but the next option or the rest of the option may become a question next time. And this is what is called as an acquired technique of art of solving an MCQ.